Welcome to the Healthcare Authority presentation focusing on Compact of Free Association, COFA Islander Healthcare. In this presentation, we will cover the following topics: overview, program basics, special enrollment periods or SEP, advanced premium tax credits, APTC, out-of-pocket costs, scenarios, COFA Islander dental care, and resources. Overview. The Compact of Free Association, or COFA, is an economic and military treaty between the United States and the Republic of the Marshall Islands, the Republic of Palau, and the Federated States of Micronesia. The Federated States are Yap, Chuuk, Pohnpei, and Koshrai. COFA Islander Healthcare began in 2019. This program enables HCA to pay the premiums and out-of-pocket costs for enrolled COFA Islanders. Here is a map of the region which highlights the countries included in the compacts. Let's review program basics. To qualify for COFA Islander Healthcare, an individual must be a COFA Islander and a Washington resident, have countable income under 133% federal poverty level, not be eligible for other minimum essential coverage such as employer-sponsored insurance, Apple Health, or Medicare, qualify for and take the maximum advance premium tax credit, or APTC, and enroll in a silver level qualified health plan. COFA Islanders must file federal taxes even if they do not meet the tax filing requirements in order to receive APTC. Please note that there is no age limit for COFA Islander healthcare. Individuals over age 65 may be eligible if they meet all criteria. COFA Islanders may be approved for one of the following Apple Health programs: Alien Emergency Medical, or AEM, Medical Care Services, MCS, or Apple Health Pregnancy Medical. COFA Islanders can enroll in AEM and COFA Islander Healthcare concurrently. When an individual is approved for MCS, their COFA Islander healthcare will end. A letter will be sent to communicate that they are no longer eligible because they have other coverage through Apple Health. Providers can check Provider 1 for current eligibility, or clients can contact DSHS for assistance. When a pregnancy due date is reported in Washington Health Plan Finder, the individual's QHP will end and Apple Health Pregnancy Medical will be approved. They can choose which program they would like to enroll in. If clients are on MCS, they do not need to apply for COFA. Special enrollment periods. A special enrollment period, or SEP, is a time outside the open enrollment period when individuals can sign up for coverage or shop for a new plan. Certain life changes or special circumstances may qualify an individual for a special enrollment period. In 2019, the Washington Health Benefit Exchange approved an exceptional circumstance for individuals newly identified as eligible for premium assistance sponsorship. The Healthcare Authority is the sponsor for those enrolled in COFA Islander Healthcare. This SEP can only be requested by the sponsor. For events that don't qualify for a special enrollment period, individuals will need to wait for the next open enrollment period to sign up or shop for a new plan. In order for individuals to be considered for the newly eligible SEP, they must complete an application on Washington Health Plan Finder and contact the Healthcare Authority COFA Islander Healthcare Customer Service. Program staff will review the application and confirm COFA Islander Healthcare eligibility and request a newly eligible SEP. Once approved, the individual will have 60 days to enroll in a plan. Plan enrollment and COFA Islander Healthcare eligibility follow the 15th of the month rules. Individuals can apply online, via phone or mobile app, or by submitting a paper application. Advanced premium tax credits. In order to qualify for COFA Islander Healthcare, individuals must take the maximum advanced premium tax credit, which is based on an individual's anticipated income. When individuals receive APTC, they must file taxes for the year they received tax credits, file taxes with their spouse if applicable, and use their 1095-A to complete Internal Revenue Service IRS Form 8962. Here is a sample of the 2019 1095-A Health Insurance Marketplace Statement. The completed form is sent to the individual via mail or email and is also available on their dashboard. COFA Islanders must use the 1095-A to complete IRS Form 8962. It is important to note that COFA Islander Healthcare is a premium assistance sponsorship program for individuals enrolled in a QHP with tax credits. Therefore, COFA Islanders enrolled in the program are required to reconcile the APTC they received during the plan year. IRS Form 8962 must be completed and filed with IRS Form 1040. Out-of-pocket costs. To pay for out-of-pocket costs like copays, deductibles, coinsurance, and prescriptions, COFA Islanders receive a cost-sharing card from Navia Benefit Solutions. COFA Islanders must ensure that their doctor, hospital, and pharmacy are in network. If they are not, the cost-sharing card cannot be used. Additionally, the card cannot be used for insurance premiums or non-medical items. There are two styles of the same cost-sharing card. While the card with the Navia logo was phased out in 2019, it is still valid and can be used through the expiration. All new cards that are issued will show the program logo. Each card has a $300 limit, which is replenished monthly. Additional funds may be made available for qualified expenses that exceed the monthly limit. Next, we will review two scenarios regarding the cost-sharing card. Susie went to the doctor and filled her prescriptions. She used her cost-sharing card and spent a total of $200 in March. How much will be added to her card for April? $200 will be added. HCA will always deposit up to the maximum monthly amount of $300. Gene has COFA Islander Healthcare and needs to get his medicine. The prescription is covered by his insurance and will cost $25. He already had medical bills totaling $300 this month, the maximum amount, and cannot wait. How can he pay for his prescription? He can contact HCA and request additional funds, or if it is the weekend, he can use his own funds and get reimbursed. Let's review other scenarios you may encounter. Scenario 1. Maple receives a bill from her insurance plan for her monthly premium and is concerned because she has an appointment next week. Should she pay her bill? No. HCA pays the insurance premiums directly to the carriers for individuals enrolled in COFA Islander Healthcare. The bill is for her records only. Please note that some online accounts may include an option to enroll in autopay. Please do not select this option since HCA works with the plans directly to ensure payment is made. Scenario 2. Maple went to the hospital and gave them her insurance information. Later, she received a bill for $225. What steps should she take? Maple should confirm that her insurance plan has paid their part of the bill and then use the cost-sharing card to pay the coinsurance. Scenario 3. Barry is selecting his silver level QHP in Washington Health Plan Finder. He needs to go to the dentist and sees that he can also choose a qualified dental plan. Can Barry get dental insurance? Yes, he can. However, he will be responsible for the dental premiums and out-of-pocket costs until 2021 when COFA Islander Dental Care is implemented. Scenario 4. Oak had Washington Apple Health Pregnancy Medical and had her baby in July. She renews her medical coverage, but it will end in September. She wants to keep free insurance after the Apple Health ends. Can she enroll in COFA Islander Healthcare? Yes, due to the end of her Apple Health, and as long as she continues to meet all eligibility requirements, she will be granted a special enrollment period to enroll in a silver level QHP. Scenario 5. Oak enrolled in a QHP that starts 9/1 and is approved for COFA Islander Healthcare. She goes to the doctor on 9/4 and tells her doctor she has COFA, but the doctor says she does not have insurance. What are her next steps? COFA Islander Healthcare is not insurance. Oak should tell her doctor the name of her QHP so that they can verify coverage. If she is told that her insurance plan is not active, Oak should contact HCA for assistance. COFA Islander Dental Care. Engrossed Senate Bill 5274 was passed by the legislature to give COFA Islanders who are also Washington residents dental benefits under a qualified dental plan. The dental benefits will begin January 2021. Open enrollment will be in 2020. To qualify for COFA dental care, an individual must meet Washington state residency requirements, have countable income under 133% of the FPL, and be either enrolled in COFA Islander Healthcare or have Medicare. There are many resources available to assist with eligibility questions and to provide general program knowledge. COFA Islander Healthcare has a dedicated website at hca.wa.gov/COFA. Here you can find the link to the COFA Outreach Toolkit, as well as relevant forms, publications, and eligibility information. We also have a direct email, cofa questions@hca.wa.gov, and a toll-free line, 800-547-3109. We have also included some links to tax filing information that you may find useful. Thank you for taking the time to view this presentation.